Welcome to Biology, the scientific study of life. Blood clotting. Most people get cuts and scrapes from time to time, yet we do not bleed to death because blood contains acid-sealing material that blocks leak. The sealant is also present in an inactive form called fibrinogen. A clot forms only when this plasma protein is converted to its active form, fibrin, which aggregates into threads that form a framework of the clot. Notice this figure. The clotting mechanism usually begins with the release of clotting factors from platelets and involves a complex chain of reactions that ultimately transform fibrinogen to fibrin. More than a dozen clotting factors have been discovered, and the mechanism is still not fully understood. A genetic mutation that affects any steps of clotting process causes hemophilia, a disease characterized by excessive bleeding from even minor cuts and bruises. Anti-clotting factors in the blood normally prevent spontaneous clotting in the absence of injury. Sometimes, however, platelets clump and fibrin coagulates within a blood vessel, blocking the flow of blood. Such a clot is called thrombus. These potential dangerous clots are more likely to form in individuals with cardiovascular disease. Cardiovascular disease. More than half the deaths in the United States are caused by cardiovascular disease, disorders of the heart and blood vessels. The tendency to develop cardiovascular disease is inherited to some extent, but lifestyle plays a large role too. Non-genetic factors that increase the risk of cardiovascular problems include smoking, lack of exercise, a diet rich in animal fat, and high concentrations of cholesterol in the blood. Cholesterol travels in the blood plasma mainly in the form of particles consisting of thousands of cholesterol molecules and other lipids bound to a protein. One type of particle, low-density lipoprotein (LDLs), often called the bad cholesterol, is associated with the deposition of cholesterol in arterial plaques. Growths that develop in the inner walls of arterial. Another type, high density lipoproteins HDLs or good cholesterol, appears to reduce the deposition of cholesterol. Exercise increase HDL concentration, whereas smoking has the opposite effect on the LDL HDL ratio. Healthy arteries have smooth inner linings that promote unimpeded blood flow. The deposition of cholesterol thickens and roughens this smooth lining. A plaque forms at the site and becomes infiltrated with fibrous connective tissue and still more cholesterol. Such plaques narrow the pore of the artery, leading to a chronic cardiovascular disease known as atherosclerosis. The rough lining of an atherosclerotic artery seems to encourage the adhesion of platelets, triggering the clotting process and interfering with circulation. Hypertension, high blood pressure, promotes atherosclerosis and increases the risk of heart attack and stroke. Atherosclerosis tends to raise blood pressure by narrowing the vessels and reducing their elasticity. According to one hypothesis, chronic high blood pressure damages the endothelium that lines arteries, promoting plaque formation. Fortunately, hypertension is simple to diagnose and can usually be controlled by diet, exercise, medication, or combination of these. A diastolic pressure above 90 may be cause for concern, and living with extreme hypertension, say 200, 120, is courting disaster. As atherosclerosis progresses, arteries become narrower and the threat of heart attack or stroke increases. There may be warning signs. For example, if a coronary, as shown in this figure, notice that atherosclerosis, these light micrographs contrast a cross section of A and B. Normal healthy artery with B, an artery partially blocked by an atherosclerosis plaque. Plaques consist mostly of fibers, connective tissue, and smooth muscle cells infiltrated with lipids. Notice the differences between healthy and the opposite. If a coronary artery is only partially blocked, the person may feel occasional chest pain, a condition known as angina pectoris. The pain is most likely to appear when the heart is laboring hard as a result of physical or emotional stress, and it signals that part of the heart is not receiving enough oxygen, O2. However, many people with atherosclerosis are completely unaware to their condition until catastrophe strikes. The final blow is usually a heart attack or a stroke. A heart attack is a death or is the death of cardiac muscle tissue resulting from prolonged blockage of one or more coronary arteries. The vessels can supply oxygen-rich blood to the heart. Because they are small in diameter to begin with, the coronary arteries are particularly vulnerable. Such blockage can destroy cardiac muscle quickly, since the constantly beating heart muscle cannot survive long without oxygen. A stroke is the death of nervous tissue in the brain, usually resulting from rupture or blockage of arteries in the head. Heart attacks and strokes frequently result from thrombus or a blood clot that clogs in artery, a key process leading to the clogging of an artery by thrombus is an inflammatory response triggered by the accumulation of LDLs in the artery's inner lining. Such an inflammation, which is analogous to the body's response to a cut infected by bacteria, can cause plaques to rupture, releasing fragments that form a thrombus. The thrombus may originate in a coronary artery or an artery in the brain, or it may develop elsewhere in the circulatory system and reach the heart or brain via the bloodstream. The transported clot, called an embolus, is swept along until it lodges in an artery too small for the clot to pass. An embolus is more likely to become trapped in a vessel that has been gnawed by plaques. The embolus blocks blood flow, the cardiac or brain tissue downstream from the obstruction may die from oxygen O2 deprivation. If damage is the heart interrupts the conduction of electrical impulses through cardiac muscle. Heart rate may change drastically, or the heart may stop beating altogether. Still, the victim may survive if the heartbeat is restored by cardiopulmonary resuscitation, SPR, or some other emergency procedure within a few minutes of the attack. The effects of a stroke and the individual's chance of survival depend on the extent and location of the damaged brain tissue.